The following training session is going to address the key points in fatal and living claims with an emphasis on industrial disease claims. The issue of fatal and living claims arises often in asbestos litigation, more so than any other type of industrial disease claim. Firstly, during this presentation, we're going to consider the most frequently pleaded heads of loss in living claims, and then move forward to consider fatal claims, and specifically those brought under the Fatal Accidents Act 1976 for the benefit of the deceased dependents, and also for the Law Reform Miscellaneous Provisions Act 1934 for the benefit of the estate. We'll then consider the key differences in damages between living and fatal claims. And finally, we'll conclude with a few helpful practice points from a claimant perspective. Firstly, let's consider living claims and the heads of loss commonly pleaded in living claims. These include the substantial claims for pain, suffering, and loss of amenity, and also other heads of loss such as lost years, aids and equipment, care and assistance, services to the anticipated date of death, income, loss of congenial employment, loss of income to the anticipated date of death, medical treatment costs, future private medical treatment agreements, often in mesothelioma claims, miscellaneous expenses, travel, and interest on past loss. The heads of loss within these claims are wide-ranging, with PSLA, loss of income and care and assistance generally being the more valuable of the losses pleaded in these types of claims. It's an obvious point, but one to bear in mind is that these losses have to be properly evidenced and proven, and invariably, when a schedule of loss is served, a defendant doing their job properly will look at these schedules of loss very carefully and try and pick apart the claims made. So evidence is very important.